Ashwagandha is one of the fastest growing supplements in the world. Sales tripled between 2020 and 2024. Influencers swear by it. Wellness magazines call it the perfect adaptogen. Senior wellness blogs recommend it for stress, sleep, energy, even memory. But here's what almost no one tells you. There are now 19 documented cases of severe liver injury linked to ashwagandha in the published medical literature. The Iceland National Pharmacovigilance System flagged it in 2022. The thyroid effects can be dramatic and unpredictable. And the medication interactions affect drugs nearly every senior takes: blood pressure pills, thyroid medications, diabetes drugs, sedatives, and immunosuppressants. So, is ashwagandha safe after 65? Helpful? Risky?
Today, I'm walking you through every well-designed human study on ashwagandha in older adults, the genuine benefits the research supports, the serious safety signals you won't see in marketing materials, the 4 medications it dangerously interacts with, the 5 conditions where seniors should not take it, and the honest answer to whether this trendy supplement belongs on your shelf or back on the stores. By the end of this video, you'll have the full picture, not the wellness influencer version. Let me start with what ashwagandha actually is. Ashwagandha, botanical name Withania somnifera, is a small shrub native to India, the Middle East, and parts of Africa. The root has been used in Ayurvedic medicine for at least 3,000 years. The Sanskrit name translates roughly as smell of the horse, referring to both the earthy smell and the traditional belief that consuming it gave the strength of a horse. In modern terms, ashwagandha is classified as an adaptogen, a vague category of plants believed to help the body adapt to stress. The active compounds are called withanolides, steroidal lactones that affect multiple body systems, including the nervous system, endocrine system, and immune system. Different ashwagandha products contain wildly different amounts of withanolides, which is one of the central problems with the supplement. The form that almost every successful clinical trial used is a specific extract called KSM-66, produced by an Indian company called Ixoreal Biomed. It's a full-spectrum root extract, standardized to at least 5% withanolides, made through a proprietary water-based extraction process. The second most studied form is Sensoril, a different extract containing both root and leaf, standardized to at least 10% withanolides. These 2 forms account for the majority of well-conducted trials. Other products labeled simply ashwagandha root powder or ashwagandha extract without a specific brand name vary enormously in potency, and the research evidence often does not transfer to them. Quick pause. Before we dive into the research, if you've been taking ashwagandha and feeling nothing or feeling unusual side effects, the form you bought is likely the explanation. Most generic ashwagandha capsules contain a fraction of the withanolide content used in studies. By the end of this video, you'll know which form is studied, which is not, and whether you should be taking either at your age. Stay with me. Let me walk through the research that supports the benefits. There are 3 main areas where ashwagandha has reasonable evidence in older adults: stress and anxiety, sleep, and muscle preservation. The strongest evidence is for stress reduction. A 2012 trial published in the Indian Journal of Psychological Medicine randomized 64 chronically stressed adults to receive either 300 milligrams of KSM-66 ashwagandha twice daily or placebo for 60 days. The ashwagandha group showed a 44% reduction in perceived stress scores, compared to roughly 5% in the placebo group. Cortisol, the main stress hormone, dropped by an average of 27% in the ashwagandha group. This was a striking finding. A 2019 replication trial with 60 adults using 600 milligrams of KSM-66 daily showed similar results: significant reductions in stress, anxiety, and morning cortisol after 8 weeks. A 2020 meta-analysis covering 12 randomized trials and over 1,000 participants concluded that ashwagandha produces moderate but consistent reductions in anxiety and stress, with effect sizes comparable to some prescription anti-anxiety medications. The mechanism appears to involve modulation of the HPA axis, the hypothalamic pituitary adrenal stress response system, and effects on the GABA neurotransmitter system, similar to how some sedatives work, but much more gentle. The second area of evidence is sleep. A 2020 study published in Curious tested KSM-66 ashwagandha, 600 milligrams daily in 80 adults with insomnia, average age 65. After 8 weeks, the ashwagandha group showed a 72% improvement in sleep efficiency compared to 29% in placebo. Sleep onset latency improved. Total sleep time increased by an average of 45 minutes. A 2021 trial focused specifically on adults over 65, using 300 milligrams of standardized ashwagandha twice daily, showed significant improvements in sleep quality, mental alertness on waking, and quality of life over 12 weeks. The sleep benefit appears genuine and is one of the more impressive findings in older adults specifically. The third area is muscle preservation and physical performance. A 2015 trial randomized 57 young men to ashwagandha or placebo alongside resistance training. The ashwagandha group showed significantly greater gains in muscle strength and size, but this was in young adults, not seniors. A more relevant 2020 study tested ashwagandha in healthy older adults engaged in light resistance training. 600 milligrams daily for 8 weeks produced modest improvements in muscle strength and reductions in muscle soreness compared to placebo. The effect size was smaller in seniors than in young men, but still measurable. The mechanism is thought to involve testosterone modulation in men. Ashwagandha modestly increases testosterone in men with low or low normal levels, and reductions in muscle inflammation. There are also smaller studies suggesting potential benefits for cognitive function, particularly memory and information processing speed. A 2017 trial on adults with mild cognitive impairment showed modest improvements after 8 weeks of 300 milligrams twice daily. But the evidence here is preliminary and the sample size is small. Pattern interrupt. I want to be very honest about something. Ashwagandha sounds wonderful when you only hear the positive findings. Stress reduction, better sleep, muscle preservation, maybe memory benefits. If the conversation stopped there, I'd probably recommend it to every senior over 65. But the conversation cannot stop there. Because the safety profile in older adults is significantly different from the safety profile in young adults, and most of the marketing you'll see online does not reflect that difference. Stay with me through the next section, because this is the part that determines whether ashwagandha is right for you. Let's talk about the safety concerns. They fall into 5 categories, and you need to understand all of them. First, liver toxicity. Between 2019 and 2024, at least 19 well-documented cases of ashwagandha-induced liver injury have been published in medical journals. The pattern is consistent. Patients begin taking ashwagandha. Within 2 to 12 weeks, they develop jaundice, dark urine, fatigue, abdominal discomfort, and elevated liver enzymes. In most cases, the liver injury resolves after stopping the supplement, but several cases required hospitalization and a few required intensive care. The Iceland National Pharmacovigilance System formally identified ashwagandha as a hepatotoxin in 2022 after a cluster of cases. The Liver Tox database, maintained by the National Institutes of Health, currently lists ashwagandha as having well-established potential for liver injury. The risk appears to be low, possibly 1 in 10,000 or fewer users, but it is real, and seniors are at higher risk because of slower drug metabolism and more frequent concurrent medications that stress the liver. There is currently no way to predict who will develop liver injury. It is not dose-dependent in a predictable way. If you take ashwagandha, you should have liver enzymes, ALT, AST, alkaline phosphatase, bilirubin, checked at baseline and again at 4 to 6 weeks. Any unexplained fatigue, dark urine, yellowing of the skin or eyes, or right upper abdominal discomfort requires immediate discontinuation and medical evaluation. Second, thyroid effects. Ashwagandha affects the thyroid in ways that can be helpful for some people and dangerous for others. Multiple studies have shown that ashwagandha increases T3 and T4 levels, the active thyroid hormones, and decreases TSH. For someone with subclinical hypothyroidism, this might be beneficial. For someone with normal thyroid function, it can push them into hyperthyroidism, racing heart, anxiety, tremor, weight loss, heat intolerance, atrial fibrillation. For someone with autoimmune thyroid disease, Hashimoto's or Graves' disease, ashwagandha can destabilize the disease unpredictably. For seniors on levothyroxine for hypothyroidism, and that's a huge population, with about 20% of women over 60 on thyroid replacement, ashwagandha can reduce the dose needed, leading to symptoms of over-replacement if the medication isn't adjusted. Before starting ashwagandha, you should know your current TSH level. If you have any thyroid condition, talk to your endocrinologist or primary care doctor first. Atrial fibrillation triggered by ashwagandha-induced hyperthyroidism has been reported in seniors. Third, drug interactions. This is the most underappreciated risk for older adults. Ashwagandha has meaningful interactions with several drug classes that seniors commonly take. Sedatives and sleep medications, benzodiazepines like lorazepam and clonazepam, sleep medications like zolpidem, and even alcohol have additive effects with ashwagandha. The combination can cause excessive drowsiness, falls, and impaired cognition. Blood pressure medications, ashwagandha modestly lowers blood pressure. Combined with prescription antihypertensives, this can cause dizziness, orthostatic hypotension, and falls. Diabetes medications, ashwagandha has mild blood sugar lowering effects. Combined with insulin or sulfonylureas, this can cause hypoglycemia. Thyroid medications, as discussed, ashwagandha increases thyroid hormone levels and can require dose adjustment of levothyroxine. Immunosuppressants. Ashwagandha has immune-stimulating effects in animal studies, which is a problem for seniors on immunosuppressive therapy after organ transplant or for autoimmune disease. It may reduce the effectiveness of medications like tacrolimus, mycophenolate, or biologics like rituximab. Fourth, autoimmune disease activation. Because ashwagandha modestly stimulates the immune system, it can trigger flares in autoimmune conditions. Reports exist of worsening rheumatoid arthritis, lupus, multiple sclerosis, and Hashimoto's thyroiditis in people who started ashwagandha. If you have any autoimmune condition, the cautious recommendation is to avoid ashwagandha or only use it under specialist supervision. Fifth, prostate effects in men. Ashwagandha modestly increases testosterone in men with low or low normal levels. For most older men, this is either neutral or mildly beneficial. But for men with prostate cancer or with PSA levels that are being closely monitored, ashwagandha could theoretically accelerate prostate cancer growth, since most prostate cancers are testosterone sensitive. If you have a history of prostate cancer, current monitoring of an elevated PSA, or are on androgen deprivation therapy, do not take ashwagandha. Pattern interrupt. If this is overwhelming, if you're realizing that ashwagandha is more complicated than the influencer videos suggested, that's the appropriate response. The risk-benefit calculation for a healthy 30-year-old taking ashwagandha is very different from the calculation for a 70-year-old taking 5 prescription medications. The free citation PDF in the description includes every study cited, the liver tox entry, and a wallet card listing the medication interactions you can take to your pharmacist. No email required. Let me now go through who should and should not take ashwagandha after 65. Seniors who may reasonably consider ashwagandha, those without thyroid disease, without autoimmune disease, without active liver concerns, not taking sedatives or sleep medications, with stable and well-controlled blood pressure, and not on insulin or sulfonylureas. The reasonable use cases are mild to moderate chronic stress that isn't responding to other approaches, mild to moderate insomnia where you've already tried magnesium and tart cherry juice without success, and possibly mild muscle weakness alongside resistance training. Seniors who should not take ashwagandha, those with any thyroid condition, including hypothyroidism on medication and any autoimmune thyroid disease, those with any autoimmune disease, those with current or recent liver problems, elevated liver enzymes, or active alcohol use, those on sedatives, sleep medications, or who have a history of falls, those on insulin or sulfonylureas with poor blood sugar control, those with a history of prostate cancer or current PSA monitoring, those scheduled for surgery within 2 weeks, and pregnant or breastfeeding individuals, though that rarely applies to our audience. Now, let me talk about how to take ashwagandha safely if you and your doctor decide it's appropriate. The form to buy is either KSM 66 or Sensoril. These are the two with the most clinical evidence. Look for the brand name on the label, not just ashwagandha extract. Expect to pay $25 to $45 per month for a quality product. The dose used in most successful trials is 300 to 600 milligrams of KSM 66 daily, or 125 to 250 milligrams of Sensoril daily. They're standardized differently. Start at the lower end, 300 milligrams of KSM 66 once daily for the first 2 weeks. If well tolerated, increase to 300 milligrams twice daily. Timing depends on your goal. For stress and anxiety reduction, take it in the morning with breakfast. For sleep, take 300 milligrams about an hour before bed. For both effects, split the dose. Once in the morning, once in the evening. Take with food to reduce stomach upset and improve absorption. How long until you see results? Stress reduction may begin within 2 to 3 weeks. Sleep improvements typically appear in 4 to 6 weeks. The full effect builds over 8 to 12 weeks. Give it at least 8 weeks before judging whether it's working for you. How long to take it? And this is important. Do not take ashwagandha continuously for more than 3 months without a break. The traditional Ayurvedic protocol is cyclical, 8 to 12 weeks on, 2 to 4 weeks off. This pattern reduces the risk of adaptation, allows liver enzymes to normalize, and gives you a chance to reassess whether you still need it. Many seniors find they don't need to restart after the break. Long-term continuous use beyond 6 months has not been adequately studied for safety. Monitoring while you take it. Get baseline liver enzymes, ALT, AST, alkaline phosphatase, bilirubin, and baseline TSH before starting. Repeat at 4 to 6 weeks. If anything is significantly elevated, stop and discuss with your doctor. Check blood pressure at home if you're on antihypertensives. Check fasting glucose if you're diabetic. Stop immediately and seek medical care for any of these warning signs: yellowing of the skin or eyes, dark urine, persistent fatigue beyond the first week, right upper abdominal pain, racing heart, tremors, unintentional weight loss, or new anxiety. Quick pattern interrupt. I want to address something I get asked constantly. Why do you sound so cautious about this? Influencers say it's perfectly safe. Because influencers usually take ashwagandha at age 35 with 1 or 2 medications. You may be taking it at age 72 on 5 medications with a slower metabolizing liver and decreased kidney function. The same dose that produces calm focus in a young adult can produce serious complications in an older adult. My job isn't to discourage you from a useful tool. My job is to make sure you understand the real risks so that you and your doctor can decide whether the potential benefits are worth them in your specific situation. That's the honest answer the title promised. Let me address some questions I hear regularly. Can I take ashwagandha with my multivitamin? Yes, no meaningful interactions there. Can I combine ashwagandha with melatonin? The combination has not been formally studied. Both have mild sedative effects, so the combination may cause more drowsiness than either alone. If you try it, use lower doses of each and only at night. Can I take ashwagandha with antidepressants? This is a serious question, and the answer requires nuance. There are case reports of serotonin syndrome-like reactions when ashwagandha was combined with SSRIs, and case reports of mania in people on antidepressants who added ashwagandha. Do not combine with any psychiatric medication without your prescribing doctor's specific approval. What about ashwagandha gummies? Most gummies contain extremely low doses, sometimes as little as 25 milligrams per serving, and use unstandardized extracts. The clinical evidence does not apply to gummies. Save your money and either use a standardized capsule or skip the supplement. What about ashwagandha tea or powder mixed in milk? The traditional way. This is how it's traditionally used in Ayurveda. The dose is variable, but typically delivers a few hundred milligrams of crude root powder, which is less concentrated than extracts. For a healthy senior trying this gently as part of a cultural tradition, the risk is lower because the dose is lower, but the same medication interactions apply. Does ashwagandha interact with the COVID vaccine or other vaccines? There's no specific evidence either way. Theoretically, because ashwagandha modestly stimulates the immune system, it might slightly enhance vaccine response, but this is speculative. If you're due for a vaccine, this is not a reason to delay the vaccine or stop the supplement, but mention it to your doctor. Is there a safer adaptogen for seniors? Possibly. Rhodiola rosea has fewer documented liver concerns and fewer thyroid effects. The evidence for stress reduction is somewhat weaker than for ashwagandha, but still meaningful. For seniors who want an adaptogen but are worried about ashwagandha's profile, rhodiola may be a more conservative choice. I'll cover rhodiola in a future video. Let me give you the practical recommendation. If you're over 65, generally healthy, not on the medications I listed, without thyroid or autoimmune conditions, and looking for help with stress or mild insomnia, ashwagandha is reasonable to try after baseline blood work and a conversation with your doctor. Use KSM 66 or Sensoril. Start low. Use cyclically. 8 to 12 weeks on, 2 to 4 weeks off. Get follow-up blood work. Watch for warning signs. Stop if anything seems wrong. If you're over 65 with any thyroid condition, autoimmune disease, liver issue, prostate cancer history, or are on the medication categories I mentioned, the honest answer is that ashwagandha is probably not the right choice for you. The risk-benefit calculation tilts the wrong way. The benefits are real but modest. The risks are uncommon but serious. Better alternatives exist for stress, sleep, and muscle preservation that don't carry the same safety concerns. The marketing around ashwagandha treats it as a universal wellness supplement that everyone should take. The research treats it as a useful but specific intervention with a real safety profile. The honest answer about ashwagandha after 65 is sometimes safe, sometimes helpful, sometimes risky, depending entirely on your specific situation. It is not a supplement to take casually because a video told you it was the perfect adaptogen. It is a supplement to take thoughtfully, with informed consent, with medical supervision, with blood work, and with attention to warning signs. In the next video on this channel, I'm reviewing Rhodiola rosea, the adaptogen with a quieter profile but a real evidence base for stress and fatigue in older adults. If you haven't subscribed yet, the link to the free citation PDF for today's studies, including the liver injury cases and the meta-analyses, is on the demand. Thank you for watching. Be cautious, ask questions, and never start anything new without checking with your healthcare team.